simulation is meant to identify areas where we can improve upon our infection control, our communication, environmental issues, and such that we want to kind of uncover before we have multiple real COVID positive patients come through the county operating rooms. All of us are here to contribute to improvement of the system. We're the best team that the county can have, but we want to be better, especially in this instance.
Set of gloves, hand hygiene.
Our perioperative team working here at County USC Medical Center, we are used to crisis management, high stress environments, etc., and we know how to function in these environments. We've had practice, we've had previous simulation exercises and such. We try to make sure that we don't take anything for granted. So our attention to detail in these processes is really very important because we don't want any weak links in the chain, especially when a patient's life is at risk, and also for the health and well-being of our fellow healthcare workers.
But I hear you have a bad cough. I'm Dr. Reaver, and this is Jan, our nurse anesthetist, and we're going to work together.
The pandemic that we're going through right now has the potential to harm everybody. Patients and nurses, doctors, techs, assistants, everybody.
All right, sir, we're going to get you to the operating room now.
One of the main important things is that your team, your perioperative team here at County USC Medical Center, our trauma center, we have a level of psychological safety when we undergo these type of simulation exercises where we're not afraid to be vulnerable. We're not judgmental on another person or on, a process that may be going amiss. The case is completed. The patient has developed a respiratory complication.
We're on that point, guys. Everybody in the room is aware we have a positive COVID-19 patient.
It's meant to identify latent threats in the system that we may not have earlier identified in all of our task force work and planning and policy making. There's a special way that we're going to exit the room that we have to follow.
You know, one person is watching the patient, one person is doing the donning and doffing, and then, the process is reversed.
4-5 out at 8:31.
Thank you.
1:30? Are we going 1:30?
You guys are proceeding to put your monitors on and such. The feeling of psychological safety that we have in such a high stress environment, and now with where we are in the world, I think it lends to us being better public servants, better healthcare workers, better doctors, better nurses, better techs, better assistants, better clerical workers, just a better team.